Imagine you're stranded on a desert island. The sun is beating down like a laser pointer on a cat, and the only thing you have to drink is a half-eaten granola bar that tastes vaguely of regret. You start to feel a little off. Your mouth feels like sandpaper, your head throbs like a bass drum at a metal concert, and you swear you just saw a mirage of a water fountain. That turns out to be a cactus wearing sunglasses. What's happening to you? You, my friend, are experiencing dehydration, the body's not so subtle way of saying, hey, I need more H2O, and I need it now. Definition. So what exactly is dehydration? In the simplest terms, it's a state where your body loses more water than it takes in, upsetting the delicate balance that keeps every cell humming along like a well-tuned orchestra. Water isn't just the stuff you pour into a glass. It makes up about 60% of an adult's body weight. Think of it as the internal ocean that transports nutrients, flushes waste, regulates temperature, and even cushions your brain. When that ocean starts to recede, the whole ecosystem feels the pinch. Now, before you start blaming your morning latte for all your woes, let's bust a quick myth. Coffee isn't the dehydration villain it's often made out to be. Yes, caffeine has a mild diuretic effect, but the water in your cup more than compensates for it. In fact, studies show that moderate coffee consumption contributes to your daily fluid intake, just as well as water does. So feel free to sip that espresso. Just don't rely on it as your sole hydration strategy, unless you enjoy the feeling of walking around with a desert in your skull. Physiology deep dive. Let's get a little scientific, but keep it light. Your body maintains water balance through a finely tuned system involving hormones, kidneys, and a bit of cellular osmosis. When you're low on fluids, sensors in your blood detect increased osmolarity. Basically, the concentration of salts and other solutes goes up because there's less water to dilute them. This triggers the release of antidiuretic hormone, ADH, from your pituitary gland, which tells your kidneys to reabsorb more water and produce concentrated, darker urine. At the same time, you feel thirst, that uncomfortable urge to chug anything that isn't alcohol. Symptoms: mild to moderate. What does dehydration actually feel like? Early on, you might notice a dry or sticky mouth, mild thirst, and a slight decrease in urine output. Your urine may shift from pale straw to a deeper yellow. Think of it as your body's way of sending a semaphore flag. Hey, I'm running low. You might also feel a bit fatigued, notice a mild headache, or find it harder to concentrate. If you've ever tried to solve a Sudoku puzzle after a sweaty workout and felt your brain lagging, dehydration could be the silent saboteur. Speaking of brains, did you know that your brain is roughly 75% water? When you're dehydrated, it can actually shrink a tiny bit. Not enough to notice in the mirror, but enough to affect cognitive performance. So next time you forget where you put your keys, ask yourself, did I drink enough water today? Or did I just give my brain a mini vacation to the Sahara? Symptoms: severe. If fluid loss continues, symptoms escalate. You might experience dizziness or lightheadedness, especially when standing up, a sign that your blood volume is dropping and your heart has to work harder to pump what's left. Your skin may lose its elasticity. Try the skin pinch test. Gently pinch the skin on the back of your hand. If it takes a second or two to snap back, you're likely dehydrated. Rapid heartbeat, low blood pressure, confusion, irritability, and even fainting can occur in severe cases. In extreme dehydration, the body's temperature regulation fails, putting you at risk for heat exhaustion or heat stroke, a dangerous combo that's as unpleasant as it sounds. Alright, we've covered the basics: what dehydration is, how it happens, and what it feels like. If you're finding this useful, smash that like button and consider subscribing for more What Is videos. We'll dive deeper into prevention and treatment right after first looking at the causes. Causes: insufficient intake. Now, why do we end up in this water deficit pickle? The most obvious cause is simply not drinking enough water. Life gets busy, meetings, errands, binge watching the latest series, and we forget to hit the water fountain. But it's not just about forgetting. Sometimes we consciously limit fluids, thinking we'll save bathroom trips, or we replace water with sugary sodas, energy drinks, or alcohol, which can actually increase fluid loss. Causes: excessive loss. On the flip side, you can lose water faster than you can replenish it through sweat, urine, vomiting, or diarrhea. Intense exercise, especially in hot or humid conditions, can produce liters of sweat per hour. Fever raises your metabolic rate and increases insensible water loss through respiration and skin. Gastrointestinal illnesses, think stomach flu or food poisoning, can purge both water and electrolytes at alarming rates. Even certain medications, like diuretics prescribed for high blood pressure or heart failure, are designed to make you pee more, which can tip the scales toward dehydration if fluid intake isn't adjusted. Alcohol's double whammy. Let's talk about alcohol for a second, the classic party foul that dehydrates you while making you think you're invincible. Alcohol suppresses ADH, the hormone that tells your kidneys to hold on to water, so you end up peeing out more than you took in. Add that to the fact that many alcoholic beverages are also diuretic themselves, and you've got a recipe for a morning after headache that feels like a tiny drummer practicing on your temples. Electrolytes and the bigger picture. Water isn't the only player in the hydration game. Electrolytes, sodium, potassium, chloride, and bicarbonate are essential for nerve impulses, muscle contractions, and maintaining fluid balance. When you lose water through sweat, you also lose salts, which is why chugging plain water after a marathon can sometimes leave you feeling crampy or dizzy. That's where sports drinks or oral rehydration solutions, ORS, come in. They contain the right ratio of water, sugars, and salts to replenish both volume and electrolyte levels quickly. Impact on performance. Even mild dehydration can sabotage physical and cognitive performance. Studies show that as little as a 2% loss of body weight from water can reduce endurance, increase perceived effort, and impair coordination. For athletes, that's the difference between a personal best and a disappointing finish. For students or office workers, it can translate to slower reaction times, poorer memory, and increased irritability. Basically, your brain working on low power mode. Long-term consequences. Chronic, low-grade dehydration isn't just a temporary inconvenience. It can contribute to several health issues over time. Recurrent urinary tract infections, kidney stones, and constipation are all linked to insufficient fluid intake. There's also emerging evidence that persistent dehydration may affect cardiovascular health, as the heart has to work harder to maintain blood pressure when plasma volume is reduced. In older adults, whose sense of thirst diminishes with age, chronic dehydration can exacerbate confusion and increase the risk of falls. Populations at risk. Who needs to be extra vigilant? Infants and young children have a higher proportion of body water and a faster turnover, making them prone to rapid dehydration from vomiting or diarrhea. Elderly individuals often experience a blunted thirst response and may have mobility issues that make getting a drink more challenging. Outdoor workers, athletes, and anyone living in hot climates face increased sweat losses. People with certain medical conditions, diabetes, cystic fibrosis, or adrenal insufficiency, also need to monitor fluid balance closely, as their bodies may lose water or electrolytes at abnormal rates. Prevention. Simple strategies. The good news? Preventing dehydration is mostly straightforward and doesn't require a PhD in physiology. First, make water your go-to beverage. Keep a reusable bottle handy. Visual cues work wonders. Aim for a baseline of about 2 liters, roughly 8 8-ounce glasses, per day, but adjust upward if you're exercising, pregnant, breastfeeding, or in a hot environment. Listen to your body. Thirst is a reliable signal, but don't wait until you're parched. Sip regularly throughout the day. The urine color chart. If you need a quick, no tools needed hydration check, just peek at your urine. Aim for a pale straw color. Think lemonade, not apple juice. Darker shades signal that it's time to drink up. Of course, if your urine looks like neon green from that new energy drink you tried, you might want to reconsider your life choices. or at least check the label. Electrolyte Smart Hydration. When you're sweating heavily, think intense workouts, long hikes, or a day spent under a blazing sun, consider adding electrolytes to your water. A pinch of salt, a splash of orange juice, or a commercial electrolyte tablet can help maintain that crucial sodium-potassium balance. Just remember, more isn't always better. Excessive sodium can raise blood pressure, so follow recommended doses. Treatment: oral rehydration. If you find yourself already dehydrated, the first line of defense is oral rehydration. Sip small amounts of water or an ORS solution, frequently rather than gulping a large volume at once. This gives your intestines time to absorb fluids without triggering vomiting. For mild to moderate dehydration, this approach is usually sufficient and can be done at home. Treatment: medical intervention. Severe dehydration, however, warrants medical attention. Signs that you need professional help include persistent vomiting, inability to keep fluids down, confusion, rapid heartbeat, low blood pressure, or urine output that's barely there. In a clinical setting, healthcare providers may administer intravenous (IV) fluids, a sterile solution of water, salts, and sometimes glucose, directly into the bloodstream to rapidly restore volume and correct electrolyte imbalances. Myth busting. 8 glasses a day. Let's debunk a common myth. The 8 glasses a day rule isn't a one-size-fits-all prescription. It's a handy guideline, but individual needs vary based on body size, activity level, climate, and health status. Some people thrive on less, others need more. The best approach is to treat hydration like a personal tuning fork. Adjust until you feel good, your urine is light, and you're not constantly thirsty. Here's a fun tidbit that doesn't come up often. Water has a surprisingly high specific heat capacity, meaning it can absorb a lot of heat before its temperature rises. This property is why sweating is such an effective cooling mechanism. Each gram of sweat that evaporates takes away roughly 2.4 joules of heat, helping to keep your core temperature stable even when the sun feels like a giant hairdryer. If you enjoyed this deep dive into dehydration, please hit the like button, leave a comment with your favorite hydration tip, and subscribe to the What Is channel for more informative, entertaining videos. Share this video with friends who might need a reminder to drink up, especially after a workout or a long day in the sun. Thanks for watching, and stay hydrated. Bonus fact. And now for a bonus fact that didn't make it into the main story. Did you know that your brain can temporarily shrink in volume when you're dehydrated, but it bounces back quickly once you rehydrate? Researchers have used MRI scans to observe that acute fluid loss can reduce brain volume by up to 0.5%, a subtle change that's enough to affect cognitive performance, but reversible within minutes of drinking water. So the next time you feel a bit foggy after a long meeting, a glass of water might just be the fastest brain-boosting hack you've got.